Hi, my name is Alyssa and I'm with Knob Noster Physical Therapy. Got my workout gear on because we're working out. And today I'm going to be doing the second video in our plank series. So once you have mastered the wall to the table or lower surface progression, our next progression would be to the floor. So there are going to be 4 different variations that I will show you today as far as working towards easiest to hardest when we're on the floor. So when we are doing floor planks, there are 2 main parts of your body that you can adjust to change the challenge. One is your feet. So most people know planks as being on the elbows with they're up on their toes, which is a true plank and is what we are looking for our end goal. However, you can modify these as needed. So instead of being up on the toes, you can be on the knees. Instead of being on the elbows, we can also be out on the hands. So I'll show you kind of those progressions and how they change that plank. So the easiest of these 4 progressions will be on our knees and on our hands. So here, again, being important that we keep everything in a straight line. So we don't want our bottom in the air. We also don't want it dropping down to the floor. We want to stay nice and straight from the knees, the hips, and the shoulders. So here, we're going to be up on the hands and on our knees, and we'll start with that 15 to 30 second hold, progressing as needed. Your next step from here would to be moved down to the elbows. So coming a little closer to the ground creates a little more flat surface and puts more pressure on those core muscles. But again, it's important that we stay in that nice straight line. Bottom's not up, bottom's not down, but we're going to stay on those knees for that next progression. Once you've mastered this position, then we will move up onto our toes as well as up onto our hands. Again, if you have any sort of wrist injury or anything that causes nerve symptoms in your hands, sometimes being up on the hands can cause a lot of pain, so we don't need to do that step if that does not work for you. But our next progression will be a hands extended plank. So we're coming here. Again, keep everything nice in line, starting at those lower rep holds and counts, and then moving up as you obviously can. The next progression from here is down on those elbows to that true plank. So again, keeping everything nice and tight and in line and holding that for as long as you can. To give you a little incentive, here at Knob PT, if you're a patient and you complete a 3-minute plank, you get a t-shirt. And if you complete a 4-minute plank, you get your name on the wall. So great reason to start practicing these planks at home, just in case you ever happen to be in here. As always, if you need anything, feel free to call the clinic or check us out at knobpt.com.